All right, part 5 of this learning plan, where we will be covering problems, communication problems. And we'll start off with conflict management. There are many common factors that lead to conflict, and we have conflict every day of our lives. Role conflict, when people have the same or similar responsibilities but have ambiguous boundaries. That's a role conflict. Communication conflict is when you fail to discuss adequately, when you don't use SBAR communication, when you give incomplete information. That's a communication conflict. A goal conflict, when one nurse places his or her personal achievements above everyone else. That can cause conflict. How about a personality conflict? You just don't like the person. That happens. It's real. You will always have that. And then there's ethical and values conflict. When you're doing something that just disagrees with you personally, that is a major conflict source, and one that only you can resolve. So what about conflicts with patients and family? There could be conflict over quality of care. How does the hospital meet their special need? How do you meet their special needs? Could be treatment decisions. A physician may order treatments from that the family doesn't agree with. Family involvement can be a source of conflict. Family has a real need to feel significant, and they may feel like their voice is not being listened to. Staffing inconsistency is a major source of conflict. Between shifts, you may have a nurse that is really good, and the next shift the nurse is not as good. That's a problem. So how do we handle these conflicts? Because we have to. If you can't handle conflicts, you can't handle life. So the key to successfully managing conflict is tailoring your response to fit each situation instead of just remembering one particular technique. Deal with the issues, not the personality. Even if it's a personality conflict, deal with the issue. Take responsibility for yourself and your participation. Communicate openly, clearly, concisely, and directly. Listen actively. Make sure you understand the issues that are coming up. Identify the key themes in the discussion and weigh the consequences. Weigh the consequences. Sometimes winning a conflict ends in losing much more. So there are 5 types of conflict resolution. And in class, we will talk about these in greater detail, but I want to just highlight them right now. Competition. Competition is win-lose. Now, when we go win-lose, lose-lose, win-win, whatever, what we're saying, when we go win-lose, we're always saying the first of those words is me, and the second of the words is the other person in the conflict. So if I compete, I'm engaging in win-lose. I'm winning over them. Lose-lose is avoiding the conflict completely. In a lose-win, which is accommodation, I'm losing to let them win. I'm giving up so they can win. In a modified win-lose, that's a compromise. And that's where nobody is really winning, nobody's really losing. Win-win is collaboration, and win-win is the best of all outcomes, and it's also the most difficult to achieve. So in class, we will talk. I have an example that I want to talk about in class in greater detail to make sure we really understand the 5 ways, the 5 methods of conflict resolution. I also want to remind you that if you should see this on a test, either write down win-lose or competition. Don't do both, because if you do it incorrectly, you'll get it wrong. So how do we deal with difficult people? Don't get run over. Don't get run over by a person who is bullying you. Stand up for yourself. Give them a little time to rant. They may not be angry at you. You may just be the first person they came across. Let them get it out of their system and then find out what their issue really is. Sometimes you got to be a little rude to get your words in. Use that carefully. If possible, everybody sit down. It's harder to be more aggressive when you're sitting down. Maintain eye contact. Don't argue with them or try to cut them down or try to prove them wrong. Let them have their say. Learn the issue. Many times when you know the issue, the outcome becomes obvious. When they finally hear you, try to be friendly. Try to accept them and work with them together. That's accommodation. When this happens, when you employ conflict resolution, it is possible to form stronger bonds than you ever had before because they trust you. They know that you listen to them and you understand them better. Now, what is lateral violence and bullying? I have on that phrase, nurses eating their young. Lateral violence is seen commonly in nurses. It's seen everywhere. But let's just talk in nursing. This would be the more experienced nurses bullying the newer nurses, or the baptism by fire. The experienced nurse throwing the new nurse into a situation where they are ill prepared, and the older nurse saying they'll sink or swim. They got to learn somehow. Learn this way. That is actually lateral violence. That is a form of bullying, and that is wrong. That has to stop. And I'm hoping as you move into the nursing profession and as you move through the nursing profession that you don't employ those techniques, that you don't stand out, you don't allow people to push you like that. It's hard. It's hard to stand up to it. It really is. But if you don't, you'll be run over, and that's a good way of being pushed right out of the profession. A lot of times, lateral violence and bullying comes from anger as the source. Now, anger is actually two different feelings. It's either guilt or resentment or both. Guilt is anger that's aimed inward. I'm mad at me for something. And resentment is, I'm mad at you for what you did to me. Both accumulate over time and lead to a cycle of negative energy. This poisons relationships. If I'm always feeling guilty about something, how can I grow? How can I accept others? If I'm resentful of everyone around me, how can I learn from those people? You can't. Conflict resolution, those 5 methods, will work in these situations. Now, how can you deal with anger? Well, those pictures give you a couple of ideas. One is good. One is tasty, but not necessarily good. Stop. Stop what's going on. Look at the situation. Look for the issues. What's going on? What can you do to correct it? It may be there's nothing you can do. In that case, either be there to support or move out of the way. Look at what's happening. What is about to happen that could affect you personally? Can you change what's going on? Can you change the problem? Can you use some humor maybe? Sometimes humor makes the anger tolerable. Now use it carefully. You don't want to laugh at the person, but sometimes have you ever seen a situation where a person is ranting about something and really it's just ridiculous? Sometimes if you can show people that it's actually kind of funny, you can defuse a lot of situations. And then refocus on something positive. Take time for yourself. Exercise. If you're in a stressful situation that you can't control, that you have no way of changing, then remove yourself, treat yourself carefully and correctly. Exercise. Learn to breathe. Take time to to sit down. I hope that when you're working, that you learn to take a lunch break, even if it isn't a full 30 minutes, that you take time to sit down for yourself. Otherwise, you will be resentful of other people. And lastly, sexual harassment. This is the unwanted sexual advances or being unwanted to sexually oriented verbal comments, unwanted touching, all that. 70% of female staff nurses that were surveyed report sexual harassment by male patients or coworkers. Now, with the increasing number of men entering the nursing profession, there's a potential for men to experience sexual harassment by women. So, sexual harassment is never right. It's just that simple. It's never right. But we need to be able to identify it, address it directly. If you are the victim of sexual harassment, the first thing you need to do is say stop to the person doing it. Don't immediately go to the boss and complain. You need to be assertive and stand up for yourself. Remember, being assertive is standing up for yourself and your rights. If that doesn't work, then you bring in management. Sometimes these actions are not intended to be harassing. The person doesn't mean to offend anyone. But unless somebody says, stop, they don't know that they've crossed a line. That's it for communication. Communication is one of the major components of being a nurse. We'll never have a day where we don't communicate. So, we'll see you in class.